Hi, I'm Lynsey Henry, and I'm back for another live event with Stigma-Free Society. Now, just to remind you, please take a minute to read our video disclaimer in the video description box. And we just want to make sure we're looking out for you and your safety during this time. So once again, I'm Lynsey Henry. I am a registered clinical counselor part-time, and I also work in Surrey schools as an elementary school counselor. So that's for ages kindergarten to grade 7. Previously, I was also a teacher. I have experience working in group homes and all kinds of experience with youth in my practicum for counseling. So, our Stigma-Free Toolkit is available at stigmafreetoolkit.com, and check it out because every week we're adding new resources. And if you check us out on Instagram and follow our Facebook page, as you are right now, you'll find all the updates and all the new stuff coming for the fall. So we look forward to having you join us. All right. So today I wanted to talk a bit about a tough topic here, and that's drug use and vaping during COVID-19 in our youth and what's been going on in the world and how that might affect things like drug use and overdoses. So I'm going to start. Why is this so important right now during COVID-19? Well, the need for counseling certainly has gone up and dramatically during this time. And alongside that, I see also that drug experimentation for our youth and teens or different addiction struggles also would be a huge concern. I feel like teens might even have that kind of mentality, oh, well, there's not really much to do right now, or I can't go to the pool with my friends anymore or do as many activities, so I want to experiment with different drugs. And that's pretty scary to think of as parents and as educators that our children might be more tempted to do those things during this time. Also, a bunch of stats for you, some shocking stats that I came across from Drug Free Kids Canada. 90% of addiction begins in adolescence. Wow, that's huge. 6 drug users are between the ages of 15 and 24. So that's our high school students. That's our youth that we see. In Canada and US, they are the biggest consumers of prescription drugs and in painkillers in particular. Those painkillers that we keep in our home that we should be disposing of after use to our local drugstores and whatnot are being found by our youth and being used and abused. So that's pretty scary. Admit to having taken a legal prescription drug in the past to get high, and 55% of those teens found those prescription drugs in their own homes. Shocking. 40% of young people also have said that they were driven in a car by someone that had just taken drugs. So like I mentioned, all these stats are from Drug Free Kids Canada, and you can check out their website for more information and resources. So something I've noticed in the news a lot, we've been talking about statistics of overdose in the Lower Mainland and comparing that in the struggle we're having with COVID-19 and how that's been increasing. So in July, BC saw paramedics responding to more overdose calls in a single month than any point since the province first declared the opioid crisis a public health emergency in 2016. So there was 2,706 overdose calls in July, and that's up from an average of 2,000. The pandemic overall has peripheral effects, and that's exacerbated this overdose crisis. Until recently, it was trending downwards due to intervention programs and social supports in communities. However, June was the deadliest month for fatal overdoses in BC's history. And even at the height of COVID-19 in April, the pandemic still did not kill as many people as were killed by opioids. This increased rate of overdose has been found in private homes. So that was quite shocking for me to see. Not among the street community like you may think when we see people that are homeless and using drugs. This was a higher population in June and July of people overdosing in their private homes. So maybe more functional addicts or people that use recreationally. So that's quite scary that this is happening in our communities. I'll post a link of this article in the comments section if you want to read more about that. And it also has some really eye-catching graphics showing just different ages that are experiencing overdoses. That comparison to the COVID-19 deaths and also just where we're seeing the overdoses and more information about that, because in my research I found that to be quite shocking. Another thing I came across that hit really close to home to me was a case of a teenager at the Walnut Grove skate park, and that happened 1 year ago on August 7th, 2019. Now, I grew up in Langley, and I actually used to hang out at this skate park with my friends, and we would also go to the community center pool afterwards. So when I heard of this story of 14-year-old Carson last year, I was really hit hard, and it really hit my heart that this happened to this poor young boy at only 14 years old. So he died after experiencing severe medical distress from suspected overdose. And the updated article that I came across a few weeks ago said there's still no definitive charges being laid against the other youth that were there when all of this went down. So they said at least 30 other people, other youth, were around at the skate park when this poor young boy was experiencing signs of overdose. And they were posting on social media. And in the background, you could hear people laughing, and poor Carson was unable to walk, stand, or speak. So these are huge signs that teens need to be recognizing in their friends and in people around them, strangers, acquaintances. If somebody around you is in a public place in the community and you notice that they're having trouble speaking, they obviously must have taken some sort of drugs. Sweating could be a sign as well, not being able to speak, having a hard time walking. These are all things we need to talk about our youth, to let them know when they see these warning signs what to do, and to call our amazing first responders so that boys like Carson or girls, young girls, are not being, their lives being taken so unexpectedly. Many witnesses there. So I think that's hugely important. And I also thought to myself, well, what were the anti-drug campaigns like when I was younger? So I was born in '88. So in the '90s, a big part of anti-drug campaigns were, hey, just don't do it. Don't do drugs. And that's not realistic for our day and age. And we know as adults and as parents that, hey, kids experiment. So what are we going to do about it? And that's the now. How are we going to make changes? We can't just tell our kids not to do drugs and expect they're going to listen. So then the anti-drug campaigns in the '80s and '90s, a big one that I remember is they used an example of an egg in a commercial being like the brain. And then they took the egg and smashed it and cracked it in a pan, a fry pan, and said, this is your brain on drugs. Okay, so how is that teaching me anything about drugs? Or how is that preventing our children from taking drugs? It almost seems like a threat. Other commercials came across saying things like, just say no to drugs. Simple little slogans like that. And I just don't think that's enough. So that was from organizations like DARE, Drug Abuse Resistance Education. So what's changed? What are we doing now to help prevent this in our youth? Well, Drug Free Canada has a few commercials out that you may have seen. And one of them is the Pill Fairy, and it's this man dressed up in a fairy costume. And in the commercial, he's encouraging people to return their old medications to the drugstore so that our kids aren't coming across those prescription medications and being tempted to try them. So that was a great commercial. Another one was called the Dark Gummies commercial, and it was about edibles and the different risks for and teens and our youth. Another one was about cannabis conversations and how parents can have conversations with their kids around marijuana use. And it was a good brief commercial as well. And it gave you a website. So that website is practicekids.ca. And they have a quiz there for parents and different resources to kind of facilitate those conversations, those tough conversations about drug use with our youth, and different resources to guide you. So another statistic they listed there, they stated that more studies show that parents may be able to lower the risk of their children using drugs by up to 50% just by talking to them about it. So I know this is a tough topic, parents, to talk to your teens and youth about, but it's an important topic. So that's my thoughts there. Also, another organization I came across was Above the Influence, and that's in the United States, and they started using kind of emoji campaigns to appeal to our youth and teens. And they have a website abovetheinfluence.com with quizzes and different drug fact information, along with expert advice for parents to go to, or even youth, to find out more and really educate themselves about the different drugs and the different risks and warning signs. So I thought that was great as well. So a big thing in Canada that we do is harm reduction strategies. And we really seek to reduce harmful health, social, and economic effects of drug and substance abuse on individuals, their families, and communities. So it meets clients where they're at non-judgmentally and uses programs to reduce risks, improve health, and connect people with other health and social services. So for example, a harm reduction technique would be to teach communities and different people how to administer naloxone, and making sure, and that's for when there's opioid overdoses, you can administer naloxone, and that helps save a person's life. So that's a harm reduction strategy. As a parent, you might wonder, well, how would you approach things in a harm reduction strategy in conversations as a parent? So to me, this might look like conversations around the risks of drugs, looking up one of those websites and going through the different warning signs of overdose with your child and having an open discussion. And just saying, hey, if you know a friend of yours is taking drugs, here's some different signs you can look out for and how you can protect acquaintances in the community that may be experiencing drug overdose. Another one might be just looking for signs of alcohol poisoning in their friends as well. Maybe even providing a safe space for your child to experiment with drinking alcohol or trying marijuana. And this is to reduce the possibility that they get hurt or take too much in the community and have nowhere to turn to for help. So I know that's really controversial. I'm not a parent yet myself, but I do remember as a teenager, one of my friend's parents did allow us to experiment with alcohol a bit in her home, and it kept us safe, realistically. It kept us in a safe place where if we were to have any symptoms of alcohol poisoning or anything like that, she was right there to help and support us and make sure we didn't take too much. So that's one other thing to think about as a parent, and kind of weigh the pros and cons of the harm and risk involved in experimentation. And don't just assume if you tell your child not to do drugs or alcohol that they're going to listen. A lot of kids want to experiment, and finding that safe space to do that with being monitored may be a good option or may not, depending on yourself and your beliefs. So what might be some harm reduction strategies for schools, educators, school counselors to help connect with their youth and approach their youth? Well, there's some different presentations going on in schools. So one that I had brought to my school was called Shattering the Image. And this was a Surrey police officer that came in, and he talked to boys about gangs and drugs and different dial-a-dope operations. And he was really frank in his presentation and showed a lot of shocking statistics and things that are going on in our communities, straight up to the boys. And this was for grades 6s and 7s. And I thought it was really great in the way that he approached it so seriously and with the boys. For the girls, they watched a presentation called Project Lavender by a woman police officer in connection with gangs as well, and being the girls that might be involved in these scary situations and drug operations as well. I also came across a book list on Pinterest, different books for youth around drug use and just being aware of different stories of other youth and connecting with them through books, which I think is great. Another one I thought to myself is, why not play some videos in the classroom? As a teacher in the physical and health education curriculum, there is an objective specifically about strategies and solving problems around substance abuse. So why not share some of these maybe old drug prevention commercials with your class, and then share some of the new ones by Drug-Free Canada, and get the students to kind of look at that and analyze, hey, what approach do we think works best? And what are some strategies that we can help solve this problem of increasing drug use during COVID-19, and just opening up these tough discussions in classrooms. All right, so I'm going to segue here into vaping. This has been a huge topic in the schools as of when they came out, really, and within the last couple of years, and just seeing more and more students coming to school with e-cigs and vaping devices, and how there's a no tolerance policy around that now, and just different around vaping and e-cigs. So, some statistics for you. 1 in 5 high school kids report using e-cigs or vaping. 90% of smokers first tried tobacco products before the age of 18. So this is our youth and teens that are being drawn to these fun smelling devices and thinking nothing of it. Oh, no big deal, it's just vapor. In fact, many adolescents don't really know that these vaping devices contain nicotine, and they also have higher levels of nicotine, apparently 10 times as much as a regular cigarette. Whoa. And nicotine can cause permanent brain damage, especially in our youth and our young adults and teens. Vapors, they contain 10 different chemicals known to cause cancer or birth defects. So making this information available to youth and teens so they can make an informed decision and prevent themselves harm of being addicted to nicotine before the age of 18. So some different support that's out there. In schools, there are some presentations and resources available to teachers, educators, and parents. So the website is bc.lung.ca, and they have a vaping toolkit, and they have several different posters of infographics around frequently asked questions around vaping and e-cigarettes, info for parents, info for teachers that you can share with your class. And I'll put that great information, really helpful, in the comments section for you. As well, my school district, Surrey School District, has a brochure on electronic cigarettes, and it's available if you just search electronic cigarettes on the Surrey Schools homepage website, and they included several other really great resources, including a PowerPoint presentation that could be played maybe at an assembly in a high school. Maybe a teacher could play the PowerPoint for their class and have a good discussion around the risks of vaping. And I'll also attach that link, as well as fraserhealth.ca has lots of resources around vaping. And there was actually a poster contest that happened last year in 2019, and I started to see these posters around my school and other Surrey schools, and it was actually written by another teen themselves around the risks of vaping and different harmful effects. And I thought it was really cool that a student actually designed this themselves. And so they are up in Surrey schools, and you should look out for them. One of them says vaping is not just vapor, and states some different statistics and beautiful images that the students have drawn themselves to really catch your eye and make sure you're aware of the different risks associated with vaping and e-cigs. So I'm going to pause here for some questions, and I want to hear from you. What do you want to know from me about drug use and vaping? This isn't my specialty per se, but as I mentioned, I feel it's a really important topic to discuss. And I know last week I had trouble reading some of your questions, so I am going to take a moment. I'm not seeing any right now. I'm going to take a moment and just search on my cell phone to see if I have any questions quickly, just because they're not appearing here for some reason. So I'll have a quick look. Okay, so I do see some of those questions here, but they're not popping up on my screen, so I'm glad I looked. Thank you for being patient. All right. Although, of course, there's been a news coverage of the opioid crisis, why do people seem to be paying less attention to it? Well, I think it's because everyone's so focused on COVID-19 and Bonnie Henry talking about the deaths related to COVID-19. And unfortunately, we're not paying as much attention to the drug use and the feelings and counseling associated that people are coming up for people during this tough time. So thanks for that question, Maddie. How can teachers help students they think are using drugs when they return to school? Well, I think just connecting and building those relationships. So it can be really tough to build a relationship with a teen or youth. But if you already have that background from being their teacher last year or their school counselor from last year, just checking in and seeing how they're doing and how they're coping with things, whether they're using healthy coping strategies, if they could list a few for you, like getting outside, doing yoga, listening to music, finding a good book to read, just different anxiety strategies and whatnot. If they can list a few of those healthy coping strategies, I think that's a good sign. But if you suspect drug use and you notice they look quite down and their mental health's being affected, then you can connect with them one-on-one and have those tougher conversations around the risks of using drugs. So that's what I would say, build those relationships. How can we work to reduce the stigma around addictions? Well, I think just having conversations, having people come forward and talk about their experiences with addiction. So Stigma-Free is actually looking for a youth or teen that has experienced addiction in their life to come forward and do a talk for one of our lives and just bring awareness to it. So I think by having a youth speaker speak to their experiences, that really helps reduce the stigma, as well as celebrities to have not be afraid to talk about this. I know Demi Lovato in particular has spoken in depth and vulnerably about her experiences with both addiction and bipolar disorder and just other struggles in her life. So I really applaud celebrities for having the guts to do that and just putting themselves out there. So I would say just bring more awareness, have more speakers, be vulnerable. Last question here. How is the rise in opioid use and overdose linked to mental health in youth? Just it's an unhealthy coping strategy, basically. So they're going impulsively to use that drug to try and take care of their feelings, when really they should be finding a more healthy coping strategy, like going to talk to a counselor or other professional. So I think it just shows the impulsivity of our youth to choose something so fast, like marijuana or other drugs, rather than opening up and talking with their parent or someone they trust. So I'm going to take a moment also to reflect on that question and get back to you with a more detailed answer around how they may be related, because that's a great question and I really want to think thoroughly and think through that one. So thank you so much for that question. And I'm so glad I looked on my phone for these questions. As I mentioned last week, they weren't showing up on our Facebook page live. So that's wonderful. I was able to get to a few questions. If you have questions later on after you've watched this presentation, please feel free to type them in and I will still answer your questions and give you a quick reply. So the option's always there and I'm here for you to answer your questions to the best of my ability. So now, I usually do some sort of activity with you at the end of my presentation, and I thought I would leave it kind of open-ended today for you to do on your own and take your time with your artistic expression. But I thought I would kind of shoot you an idea that maybe teachers or educators or parents could do at home with their children. And that would be looking at one of those websites that I mentioned, abovetheinfluence.com or Drug Free Kids Canada, looking through the website, finding some statistics that you want to share with your community or your school. Find some information and shocking statistics that influence you and made you really think and made you really reflect. And I want you to create your own poster of those different facts to share in your community or at your school. So for me, two of the most shocking statistics were that 90% of addiction begins in adolescence. The number was that high. So if I was to put a poster up in my school, I would list that statistic for sure, 90%. Oh my goodness, that's huge. The second one I would definitely list is 60% of illicit drug users are between the ages of 15 and 24. So just to know that and have that information available in schools and where to go to seek help. Services like Kids Help Phone, counseling services and whatnot. And I'm going to look for a few more specific ones related to addiction to list for you as well in the comment section. Foundry is another great one offering free counseling services right now, as well as Moving Forward Family Services and just reaching out and finding a counselor and someone that specializes in this field to talk you through and help you find healthy coping strategies. So thank you so much for listening in today. I appreciate it and take care for the rest of your day.